African sleeping sickness. Causative agent is the Trypanosoma brucei gambiense. It is a flagellated unicellular protozoa parasite and causes the African trypanosomiasis, also known as the African sleeping sickness. Transmission is by the tsetse fly. It is a biological vector. A bite from the infected tsetse fly injects the parasite into the blood system. A pregnant woman may pass the infection to her baby. Most of the reported cases are found in Central Africa, such as the Democratic Republic of Congo. Only a small amount of tsetse flies are infectious. They are the size of a honeybee and they bite during the daytime hours. Their bite can be quite painful. The mode of transmission during a blood meal on the mammalian host, an infected tsetse fly injects metacyclic trypomastigotes into skin tissue. The parasites enter a lymphatic system and pass into the bloodstream. Inside the host, they transform into the bloodstream trypomastigotes and are carried to other sites throughout the body, reaching other blood fluids like lymph and spinal fluid. They continue the replication by binary fission. The entire life cycle of an African trypanosomus is represented by extracellular stages. The tsetse fly becomes infected with bloodstream trypomastigotes when taking a blood meal on an infected mammalian host. In the fly's midgut, the parasites transform into procyclic trypomastigotes and again multiply by binary fission. They leave the midgut and transform into epimastigotes, and they reach the fly's salivary glands and continue multiplication again by binary fission. The cycle in the fly takes approximately 3 weeks. Humans are the main reservoirs, but this species can also be found in animals. The symptoms include fever, headache, malaise, weight loss, and sleepiness. The symptoms usually begin to appear within 3 days to a few weeks after the initial bite. The site of infection causes redness and pain. Because of the trypanosome's ability to change surface antigens faster than the immune system can produce antibodies, the immune system is slow to respond. In its advanced stage, it affects the central nervous system, which causes emaciation and unconsciousness. Death results from heart failure or severe destruction of other organs. Diagnosis is made through laboratory methods by finding the parasite in body tissue or fluid by microscope. Treatment is by antibiotics depending on the state of the disease. Pentamidine is recommended to treat trypanosomiasis, which is widely available in the U.S. The other drugs are available in the U.S. only through the CDC, Center for Disease Control and Prevention. Constant follow-up for 2 years of cerebral spinal fluid is necessary to detect if relapse occurs.
Prevention. Unfortunately, there are no vaccines or drugs against trypanosomiasis. And the only way to prevent possible infection would be to minimize contact with the tsetse fly. It is advised that one wears long sleeves and shirts which are neutral color, because the tsetse flies are attracted to bright or dark colors. The tsetse fly is also attracted to moving vehicles, so it is highly recommended that you inspect the vehicle before entering. Also, avoid bushes and use insect repellent.
The end.